Okay. And yes, thank you everyone for being on tonight, and hopefully we can get some questions answered, as well as help give out some information as many of you navigate the world of health insurance, and especially this time of year as people are signing up for their coverage for the following year. My name's Heather Martin. I'm the Policy Director for the Maine Association for the Education of Young Children. Prior to that, I taught in childcare for 20 years, so navigating healthcare was very much always stressful for me as an early childhood educator who, did not make a lot of money, but knew that healthcare was insurance was a necessity in my life. So glad you're able to be here today, as we know this is very important to all of us. But I also want to welcome Meg Garrett-Reed and Jillian Clark, who will be walking us through the process of on CoverMe.gov tonight and answering your questions. So I'll let Meg and Jillian introduce themselves.
Thanks so much, Heather. And thank you for inviting us to be here today. We were on a webinar during the day with Heather last week, hosted by the Administration for Children and Families, but no, middle of the day is a very hard time for folks to join. So really appreciate you pulling this together and happy to be here. My name is Meg Garrett-Reed. I'm the Director of the Office of the Health Insurance Marketplace. We're a division of the Maine Department of Health and Human Services, and we operate CoverMe.gov, Maine's insurance marketplace. Jillian, do you want to introduce yourself too?
Yeah, my name is Jillian Clark. I'm the Outreach and Communications Associate for the Office of the Health Insurance Marketplace, and I've been here for just a few months now. So excited to be here and to answer any questions.
Thank you so much. So, we'll have just a short kind of presentation to walk us through the CoverMe.gov site. So you can all see it, from a navigator's point, whether you're a director trying to help educators access or you're accessing your own, as well as we'll leave a good amount of time for a Q&A at the end. And how we'll structure that. Right now we're a smaller group than 60, so I think we could come off mute, kind of do it more casually if you'd like, if you want to raise a hand. But if you certainly, if you're not in a place to speak, you can also type questions into the chat and we'll monitor that as well. So just know that we do want to get questions answered tonight. So I will turn it over, and Meg, if you want to screen share, I think you're able to.
Yes, I should have tested earlier, but it does
okay.
look like it should be all set. I'll start before I share, just with a few words of background maybe about CoverMe.gov. So we are Maine's health insurance marketplace. Basically what that means is we're kind of try to be and want to be the resource for anyone to come to if they don't have health insurance through an employer, which is obviously, a common way that folks get it, but we know there's lots of industries and lots of situations that mean that there are folks who don't have access that way. And if they don't have coverage already through a program like Maine Care or like Medicare. So really want to be a bit of a one-stop shop for people who are looking. And what sets us apart, from a Google search or other resources that are out there for health insurance are really two things. The first is that we are the only place to go to qualify for financial assistance from the federal government, known as advanced premium tax credits, that can reduce the premium that you pay monthly for your health insurance, as well as what's known as cost sharing reductions, which some people qualify for based on income, that actually can even make it less expensive when you're going and seeking care. Out-of-pocket costs like copays or coinsurance are lower for people who qualify. So really helpful financial assistance. And again, we're the only place to qualify. Going through a health insurance carrier directly, you're not going to be able to get that benefit. The other thing that sets us apart is all the health insurance plans on CoverMe.gov are comprehensive quality health insurance. So these aren't plans where you enroll and then find out there's actually fine print that means your hospital stay and your doctor visit are all not covered. There are varying levels of coverage through the marketplace, but all of these are plans that have met standards for the quality and the comprehensiveness and cover a set of 10 essential health benefits as they're known, that are most of what you think of in terms of regular health services. So really important there. I just actually met a woman today who had shopped for insurance and been Googling and worked through someone who she thought was an agent and ended up in a plan known as an indemnity plan that they called health insurance, but really wasn't a quality health insurance plan. So kind of a couple of reasons, to come to us as a resource for health insurance if you do need it. And I should say, I'll, speak kind of like like, if you need it, I know we may have a mixed audience of folks who may be interested in this presentation for themselves, or maybe thinking about employees or thinking about offering coverage through their childcare center. So we'll probably say, you, but understand there's maybe a mixed audience here. So with that, I'm not going to walk through slides. Instead of an informal presentation, I'm just going to share my browser screen and do some walkthroughs of some of the tools that are available through coverme.gov. So let me see if I can get that pulled up. You can see my screen, great. Just disregard, by the way, I have a little header at the top of the page for myself, because this is our website and we maintain it. That won't show up if you're looking, but hard for me to log out. So this is the coverme.gov homepage. The first tool that I just wanted to introduce is something that we call Plan Compare. It's available here under the Get Started menu, or as one of kind of the main buttons here under our pretty new header that we just added. So See Plans is where to click. The idea of this tool is, we know that sometimes it can be a little overwhelming to think about sitting down and filling in a whole, application. I will say I'll show our application later. It can be really quick to fill out. It's not too onerous a process, but still, you yourself may want to take a look and kind of check eligibility quickly, or this is a great tool to share with people who aren't sure what they qualify for. Very quick and easy to fill out. So I'll just give an example. 04101 as an example county. So you enter your county. That's because the plan options vary based on the geography of Maine and the county that you're in. You'll just be asked for a few really basic pieces of information about yourself and your household member. So anyone essentially kind of filing taxes with you is who to include here, even if they don't need coverage. We want to know some information about them because it's important for how we determine eligibility. So I'll just add a dependent to this household. Think about, one adult and a child here. There's some optional questions that you can choose to fill out or not to rate your health. That's just a self-assessment of kind of, are you somebody in great health who's really maybe going for a checkup most years, or, do you know you're going to be needing to go for lots of appointments, maybe have an illness that needs to be treated, and any expected procedures. That's not any information that goes to a health insurance company or is used to, decide what plan you can or can't get. It's actually used to help with a total cost estimate for your insurance and your health kind of care throughout the year, to help just get a clear idea of what you might be spending and to compare plans that way. So again, totally optional, but I always like to clarify that because we have had questions about how those work, and a few other factors that can impact eligibility there. So that's really all it takes, just age at this stage. And then we ask for an estimate of income for the coming year or the current year if somebody's enrolling during the year. I'll just put in $45,000 here and estimate financial assistance. There's a quick summary of estimated eligibility here. So you can see this household with an adult and a child and an income of $45,000 could qualify for $542 a month to lower premiums, as well as those cost sharing reductions that I was mentioning earlier. Next step, you can doctors, hospitals that you want to make sure in the network for the plan, and also any prescription drugs you take, and get a sense. I'll actually put in a drug here just so I can show what that looks like. Sometimes I don't know, there's so many different doses and things, but I'll just use Lipitor as an example. It'll just take a minute to load and gives a quick preview of kind of how to use the tool, the different sort of features available to compare plans here. And then once it's loaded, we can continue to plans. It'll take a minute. It might also be very busy right now. I should have mentioned, and I'll say it again at the end, but we have a deadline coming up tomorrow, actually. Tomorrow is the last day to choose a plan that's effective on January 1st. So open enrollment, which is our one time of year when anyone can come in, and if they qualify, choose a plan, that extends until January 15th. But from the day after tomorrow until January 15th, the first day of the coverage period would be February 1st. So it's a very busy time, lots of calls today, and probably lots of people using this tool at the moment. That being said, so here's the tool itself that shows plans. it sorts the plans instead of just being based on the premium paid monthly on that total cost of care. I didn't put in any conditions or anything, so this is going to be premium heavy, but that's the distinction and the reason that we ask those questions. And you can see here that this individual and the child, their child, could qualify for a plan for $18.12 a month. And actually, this is a good example. I should have looked a little bit more closely. Some premiums even lower, so a $2 premium. But the reason this plan is appearing above is because the out-of-pocket costs would be a little bit lower. So that just gives you an idea. Oh, I was going to show coverage, and I did choose a prescription drug that it looks like is an uncommon dosage, but it'll show whether the drug is covered or not. And if a drug is covered by the plan, it will actually show what the copay is when you hover over here. So that's something where I know, if folks are taking a particular prescription, the cost savings, if a plan covers it, more generously with a lower copay, can be really significant. So that's just a quick overview. There's a lot more here in terms of filters that can be used, but just kind of wanted to walk through to show how quick and easy it is to kind of get a sense of what you could be paying and what the plans look like just by answering a few questions. Other than the plan compare tool, I did also want to just give a quick preview of what the application itself looks like as well. So if you're on coverme.gov, I'll just go back. You can create an account if you don't already have one, and that's a very straightforward process, just creating a username. So I won't do that whole process. Once you have created an account, hit the screen and enter some personal information about yourself. So I've done lots of examples of this, but I will just come up with some information. And this is just a test environment, I'll say, so you may see information for other consumers in here, but they're all made up people, no real people in this example that I'm showing. So it'll ask if the person needs coverage. There could be an adult applying, let's say, maybe for their kids. So that's why we ask the question, because they would need to create an account. We'll ask for a little bit of information to find your identity. Continue on. When somebody's first setting up an account, it'll do a quick check just to make sure that they don't already exist in our system. We'll match people to an existing application if we have one for them. And then it will move through. There is typically a identity verification stage where you just have to answer some of those questions. You may have done it if you've, applied for a car loan or something online before, where it'll ask you something about your history and what was your, rent in this, year, and what address did you live in, that sort of thing. And then the application will just ask a few more questions to determine eligibility at baseline. So, asking about citizenship, asking about tribal status, because people who are members of federally recognized tribes have additional benefits through the marketplace and certain types of plans they can enroll in. Want to make sure someone's not incarcerated. And then mailing address, home address. I will just drop in an address here so I can show you our office in Augusta. And then different contact preferences. You can just get emails from us, that sort of easy thing. Oops, this wouldn't normally appear. It's because I'm in as an admin. So just ignore that. Oh, and I need to put in state as well. This is always the challenge of doing it live, but I like to just walk through the application because it's a little bit easier to just, visualize it rather than trying to describe or show slides. Just a consent page. Oh, here we go. So this is where identity is verified. So this is just a placeholder in this environment. So then there will be a question about applying for premium reduction. So for somebody who's not looking for financial assistance, that stuff that we just completed is pretty much all that they need to do. You just put in some very basic information about yourself. The application for premium reductions, we will run through. I will note one thing here. I didn't show it in the previous example, but another, I think really helpful component of coverme.gov is that when you apply through us, we also assess eligibility for main care in addition to financial assistance through the marketplace. So, sometimes there are families with income that qualify their children for main care or the chip, even though the parents might qualify for a marketplace plan with financial assistance. And rather than needing to apply in 2 different places or figure out eligibility on your own using information, just one application through us can make an assessment of that eligibility. And then we actually send the application over to the Office for Family Independence here at Maine Department of Health and Human Services to make a final determination. So then for the application itself, it'll ask to add a little bit of income and coverage information. So, filing taxes is key. That's the way that we sort of income is checked later. And want to get a sense of, members of the household and if there are dependents. Entering income from an employer. So we can once again use 45,000 here. We do ask for employer name. That's just a requirement of the federal government for marketplaces. So don't have an option there. Unfortunately, have to ask for it. And then it'll ask how often that income is received. So intended to kind of help make it a little bit easier if you've got different amounts of income at different times of the year to just enter that in. And then, start and end dates. We'll save that. Self-employment income can be entered separately. Other forms of income, again, I'm just kind of showing us a relatively simple example, but I think for a lot of folks, they don't have necessarily deductions or income of other forms. It'll ask a set of questions about access to other health insurance because that is another prerequisite sort of required that you don't have access to affordable coverage through another program in order to qualify for financial assistance through the marketplace. So I will answer no to these questions. And then there is a final set of questions that are kind of special circumstances that can qualify people for main care. So we ask about them to make sure that we can direct anybody whose circumstances would make them eligible over. So I'll just answer no to all these too. And that's the whole application. There's no need at the point of application to upload any documents, to, sort of have to dig out much more information other than social security numbers and birth dates for the folks in your family. Of course, if you have multiple family members, you are entering in this information for each of them. But no need to dig out a lot of documentation as you're applying, which I always want to make clear to folks. There is just a review and, agreeing to some of the different processes that we run through, things like we're going to check your information against some federal data sources, and that we're going to check eligibility for main care as well. And then I think I put in my name. But that's the whole application. So there's obviously much more I could dig into there, but really I just kind of wanted to walk through it very quickly just to give a little overview of kind of, how relatively I think simple and pretty user-friendly it is to do it. Because again, I know that feeling of thinking, oh, I've got to sit down at the computer and, fill out this whole application. But again, it can be done really quite quickly. And then you can use our platform to move through. I didn't go to this step, but move right through and select a plan and enroll that way. So that is, the application itself. I think just a couple other things that I wanted to sort of highlight for this group, and then I can wrap up and we can go to questions. One really important feature, I think, is being able to find help near you. So we have this directory, again, under the Get Help menu on coverme.gov, find help near you. This is a directory of brokers and Maine enrollment assisters that are certified by coverme.gov to provide help. So you can drop in your address. You'll be able to see who's nearby you. You can tell that I'm in the Mid-Coast. I'm in South Thomaston. So this is kind of my local area. There are some distinctions, so just a little information. Brokers, health insurance brokers, are professionals typically who are kind of in the business of selling insurance. They're the folks who are trained and certified and allowed to give actual advice and sort of tell you this is the plan that I think you should enroll in. That's the best choice for you. Maine enrollment assisters, on the other hand, tend to be staff or sometimes volunteers of nonprofit organizations or sometimes healthcare providers around the state. facilitate, who also help people enroll. They're not allowed to give, they can give advice and sort of help inform choices about health plans, but they're not allowed to kind of say this is the one to go for. That's one restriction that they have. But I do like to highlight they're generally sort of trained in both main care and marketplace eligibility. So they're a great resource, especially for people who aren't sure what they might qualify for, because they can help enroll in both, whereas health insurance brokers are typically kind of more focused on commercial health insurance. But we, want to make this available because they are a great resource. Again, if you're unsure kind of where to start or want an extra helping hand or have any questions about the application. The last, I think, feature that I will share is one maybe more targeted to anyone on the phone who runs a small business, is operating, a childcare center and has employees. If you're thinking about offering coverage for them or do offer coverage for them, but are weighing, costs of that, we have a small business decision support tool on CoverMe.gov. Which can help to sort of think about your options for coverage. So this is, again, a little bit sort of like the equivalent for businesses of what that plan can that I showed. It just provides a quick form where you can enter some basic information about your business. Location, again, you'll put in, let's see, Jillian, information about the employees, not that this goes to, again, health insurers or anything. That's just to kind of help keep folks straight. I'm just going to put in some different information here just so that I can show what it looks like when the results pop up. And basically the idea of this tool is to give you a sense of, with the same contribution from your business, kind of what would the cost for employees be at an aggregate level, but also getting a sense of individually what it might mean for them, which is why I'm trying to kind of use a range of different kind of ages and incomes. Let's see. You continue, we'll ask about contributions and then sort of the amount that you'd want your business to contribute to health insurance. And then the three options that are outlined here, and to be clear, this is, by no means a totally comprehensive or completely precise tool. It's more to give a sense directionally and, prompt some thinking and give information to you to bring potentially to a health insurance broker and get their feedback on, but gives you a sense of what the differences are between either offering, a group plan, a traditional small business health insurance plan that all the members are enrolled in, using a health reimbursement arrangement, so kind of a fixed contribution that you hand over to the employee that they can actually bring over to CoverMe.gov and apply to their premium now due to a federal rule change that happened a few years ago. Or just raising wages and sending consumers over to healthcare.gov, or I'm sorry, CoverMe.gov, and allowing them to qualify for our financial assistance. I will say small group health insurance and the individual health coverage or health reimbursement arrangement generally would disqualify an employee from being able to qualify for financial assistance on CoverMe.gov because it would count as that offer of other, we call it minimum essential coverage, other affordable coverage. There are some caveats there. It depends on what the premium would cost them and sort of whether it would meet an affordability test that's applied. But typically, if they have access to that and it's going to be a reasonably affordable premium, they couldn't qualify. So just something to think about. It kind of shows at a group level what it means, and then you can also, because you can see there's a range of impact here, hit see details, and that's when that information per employee will pop up where you can kind of get a sense. Maybe one employee really benefits, but another is going to be really challenged by this arrangement versus all of them sort of having something that could work for them. So show that tool as well to mention it, because typically we're very, very focused on the individual market side and customers coming in to shop for themselves. But I know the audience today might be a little bit different. So I was close to on time, Heather, ran over a little bit, I know, but I will pause there. If there are any questions from the group, or certainly, Jillian, if you think I missed anything that I should have highlighted, or Heather, if there was anything helpful we covered last time that you'd like me to walk through, please just let me know. Otherwise, happy to take questions from the whole group.
Yeah, I've got nothing. So I'd be interested to hear what questions are and what folks are thinking.
Hi, Meg. I have a question for you. I own a childcare in Bangor, and we do provide healthcare. We use a health insurance company, and this is our second year, so we have open enrollment for our second time. Okay, so just about to start our second year, and this past year we only had one employee. Now we have 4 employees that were interested in our coverage. And I found it more difficult this time because it was very difficult to say how much money the monthly rates were going to be until the enrollment ended. Is that the same type of situation that would happen if we were, I'm assuming it is, but for me, I have no idea about health insurance. And I am very much in the unknown, if you will, and that is not my forte. What could I expect if I was to look at the CoverMe.com, the CoverMe.gov website and went through that whole piece of the small business part? How would that process look? Would it be similar to what I'm doing right now?
Yeah, just out of curiosity, and I will admit, I am much more experienced on the individual market side.
Okay. Yep.
So I'm trying to show some tools on small group, but it's not necessarily my area of expertise. When you mentioned having a hard time sort of getting a sense of the premium, are you meaning for the employees or kind of in the end what you as a business?
Yes, for the employee. So we contribute $100 a month for our employees, and then the rest of it comes out of their payroll deduction. So for them, of course, they're trying to plan accordingly for January with this proposed plan. But again, we're not sure until the enrollment ends who is going to sign up and if those rates change. So it's a bit wishy-washy, if you will. And for those who are really having a hardship with their financial situations, wishy-washy doesn't work. It's very difficult to have conversations like that. So I guess really what I'm trying to figure out is, is the process still the same to go the opposite?
Yeah. So I guess what I would say is, I don't know if you're already working with a broker, but a health insurance broker might be the best resource for that question. If it's something where the health insurance company is kind of offering a different rate depending on whether it's 1 employee or 4 employees enrolling. Unfortunately, that's not something that we could help with. That is sort of within the purview, I think, of the insurance company and a little outside my area of expertise. I will say, on the individual market side, the rates are set. They are what they are. They don't change at all throughout open enrollment. So somebody can preview even when we put them up before open enrollment starts, and they're not going to change because they are, on the individual market side. It's not looking at the group of employees together. It really is just based on an individual level. So that wouldn't impact it. But it's interesting feedback to hear about the small group. I wasn't aware of that. I thought typically they were kind of setting rates and not making changes. So I'm happy to follow up on that. Some of my colleagues over at the Bureau of Insurance may have a better answer for you on that. So I'd be happy to make that connection if you did want to follow up with them afterwards.
I appreciate that. Yeah, the more information, the better for me, at least. So that would be great. Thank you.
Sure.
And Meg, we do have a question from Deborah in the chat.
Yeah, Deborah, that is a great question. I'm glad that you asked it. Yes, so if you offer an individual coverage health reimbursement arrangement, it's sort of treated the same way as offering a health plan, to be honest. So what we would do is ask the employee, if they came to CoverMe.gov, to enter information about what the contribution from you was and sort of how much they're receiving. If the individual CoverageHRA kind of includes enough of a contribution that their premium would be considered affordable with that contribution applied, it would make them ineligible for financial assistance through CoverMe.gov, regardless of whether or not they decided to accept it. If the contribution is relatively small, especially premiums differ based on age. So, an older employee, maybe if you're offering an individual CoverageHRA to everybody with the same amount of money, maybe for a young employee, that might make coverage affordable to them, but not for the older employee. If they come in and enter that information with us, And we actually have a tool. I'm happy to show that, or I can send maybe the link around for folks to look at. They can kind of get a sense of the affordability of the individual coverage HRA. They can choose to decline it if it's unaffordable, and then they can still qualify for financial assistance with us. So that's a little bit of the asterisk that I put next to it. It's not a totally binary. If you're offering it, they can't qualify, but in most circumstances, it would make them ineligible for financial assistance. There's not an ability to kind of combine, an employer contribution and the financial assistance together.
I had received a question too, Meg. It said, if we are offered insurance through our employer, can we use CoverMe.gov for our children only if our premiums are too high to add our children?
That's an awesome question too. I almost like it was set up. So yes, that is a new change this year, which we are totally thrilled about. Previously, and I keep going back to this affordability test, but the way that it worked, if you were offered employer-sponsored insurance, is that was based just on the affordability of the premium for the employee alone. So as we all know, there's lots of cases where premium might be pretty reasonable for just you, but adding your family is gonna, make it much too expensive. So the percent, the way the affordability test works is a percent of your income and how much you're kind of spending as a percent of your income on your health insurance premiums. And it's a little over 9%. So if that premium for your whole family is going to be a little more than sort of that 9% of your total income, that would mean it's unaffordable for your kids. And yes, thanks to this new rule change this year, for the first year, we can differentiate that and say, okay, you can't qualify for financial assistance because you have this access to affordable coverage, but your kids don't. So they can come on in. We can offer them financial assistance if you otherwise qualify. So that is really great news. There's some added questions in our application. So I kind of blew through that page that asked about access to other health coverage, but that would be the place where you would go in and you could answer some questions about whether the plan is self-only, whether it's offered to kids, and you would answer some questions about the cost of it. And then we would make that calculation in the back end for you. I was just reading another, does the employee have to work in childcare? I work at a YMCA where only full-time staff are offered insurance. So no, absolutely not. We are here for everybody at CoverMe.gov. So any situation, like I said, just anybody who doesn't have insurance through another program is welcome here, and that financial assistance is available.
I was wondering if you could explain a little bit what you're seeing around the Inflation Reduction Act, which to my understanding increased eligibility for main care. Is there some financial, like what's a cutoff income? Is there some like a test like that people could think of?
Yeah, that one's really tricky because it is different than main care that does have sort of a cutoff, and it's if you're earning more than this, you're probably not going to qualify. Whether or not people qualify through CoverMe.gov, sorry about the dog crying, is kind of a combination again of what's your household income and then what is a premium going to cost you, and we use what we call a benchmark kind of a middle of the pack premium that's determined every year, and if that's going to exceed 8.5% of your total income, that's where the sort of cutoff is. So what previously used to be the case before the Inflation Reduction Act was there was a hard cutoff, and that was 400% of the federal poverty level. Sometimes I'm able to pull that up quickly, but I won't do it now. I'm thinking, Jillian, maybe if on the side you can pull up those numbers so that we can share them in the chat or something, that would be great. But 400% of federal poverty level was where subsidies just weren't available no matter what, even if the premium was really unaffordable. So again, older folks in northern Maine, so we have different geographic rating areas as they're known in Maine, and health insurance tends to be a little bit more expensive in western and northern Maine for people. They were just kind of out of luck no matter what. What the Inflation Reduction Act did was remove that cap altogether. So now, even if your income is higher, if your premium is going to be unaffordable, you can qualify for financial assistance that brings down your contribution or the cost to you to no more than 8.5% of your income. And I will say, for lower incomes down the income scale, it's much lower than that. I realized the way that I described that was maybe a little bit confusing, but not everybody is expected to contribute that much. Other folks pay as little as, it's 0% of their income, just a couple dollars a month, depending on what the total household income is. So got a question about the application process, enlisting all members in the household, regardless of your relationship with them. Have helped a couple employees sign up and one has a roommate. Does she have to add the roommate under the household member? So nope. The way that we kind of talk about household is really about tax household. So it's only people that you would be including when you file your taxes. So basically, in most cases, that means spouse or domestic partner and any dependents that you have. There are some really unusual cases, grandparents maybe with custody of a grandchild or taking care of them. So we can definitely help with those. But if you're just under the same roof as somebody, doesn't make them part of your household, you only include, the people and the income that they're bringing in if they're people that you would file your taxes with. On husband's insurance and retiring around March, can we get insurance? Again, so many really good questions tonight. Yes, you can. So I mentioned the open enrollment period. And again, that's really the one time of year when the doors are wide open. Anyone can come in, no questions asked. We want to sign up as many people now as possible. And, if you miss that window and then have a health event or, get in an accident, unfortunately, outside of open enrollment, we can't necessarily help, but there are what are known as qualifying life events outside of open enrollment that do allow people to sign up an enrollment period. And one of those is losing access to other minimum essential coverage. So if you're on an employee plan and he's retiring and both of you need coverage, or even, if he's going into Medicare and you need coverage, that would be a qualifying life event. So you could come in, complete, the application for that qualifying life event. It's actually self-service. We'll just ask you the question and you just need to attest and tell us that that's what happened, and you'll be able to choose a plan and enroll at that point. Name of the site again, coverme.gov. Heather, you were on it. Thank you for sharing that. And thanks, Jillian, for sharing the FPL level 2. I try to have those handy because it's always so helpful to translate, because, percentage of the federal poverty level doesn't mean a lot, even to me working in the space for a while. It's a helpful reminder. So that's a good, I think it's 54,000 for one person, and then, would be more depending on the number of household members. So yeah, a question about sort of filing and different, custody arrangements or organization of kind of kids on taxes. So you're right, we would want to include, this is a little bit of a trickier one, so I maybe shouldn't be too definitive. We can follow up, and we've actually got a guide that we use and can share for that situation. Typically with children, definitely would want to include the child claimed on taxes. Children are a little bit of an exception. If there's other children living in the household, we do sometimes want to include them on the application, but just mark them as, not needing coverage. They can't be enrolled and kind of receive financial assistance with a parent that's not claiming them as a dependent, but may be included in the household. So that one's a little bit is technical enough that, again, maybe that's one that we can take back and follow up with some resources on. But typically that children are a little bit of an exception, where even if you're not claiming them on your taxes, but they're living with you, you're caring for them. Sometimes that can be one of those exceptions to the rule.
Is that something too, Meg, if folks were to reach out to, insurance navigators or brokers, they would have the definitive answers as well?
100%.
Yeah, so I do highly recommend people utilize that, because I think that's something I never even knew existed when I was going through this, and to just have a person to talk to and, think about different things is super helpful. And those, I don't know if we mentioned, those are free. So those navigators and brokers are free to talk to and help you navigate some of these questions as well.
Yeah, 100%. And I think particularly in a situation like that, that's one where a navigator or main enrollment assister, is going to be really helpful, because they're familiar with those different scenarios, can sit and talk through and also, to some degree help understand the decisions and what it means for eligibility. It's one thing to put it in the application and kind of get the response back. We just worked with had a little bit of a complicated household, and we're able to, get back and provide an explanation that, can help you just understand what it can mean and use that to inform your choices too. So definitely that's a situation where you're totally right, Heather. That would be a perfect, a reason to give a navigator or main enrollment assistor a call and make an appointment or just talk with them over the phone.
I was talking with a provider today. She actually owns the childcare. She was hoping to be on tonight, but I don't think she was able to make it on. But she was asking about pre-existing conditions, and are premiums generally going up around pre-existing conditions, or are there still things in law that kind of prevent that?
Yep, still things in law. So health plans cannot discriminate against you in any way for having pre-existing conditions. Another, great result of the Affordable Care Act. So can't deny enrolling you and cannot charge you any differently based on any, previous health status. So really, I think I sort of mentioned both of them in passing, but the only two remaining reasons that health plans can kind of vary premiums in the state of Maine are, again, geographically, they're allowed to have these different rating areas where the premiums can be different. And then based on age, where there's kind of a sliding scale where each year it dials up a little bit. Outside of that, they have to, apply the same premium and offer the same premium to everybody. So yeah, definitely would want to provide that reassurance to folks that they don't need to worry about that now or question it. So the 9% cutoff for eligibility is that before or after taxes deductions have been taken out. So we use modified adjusted gross income. So again, this is a little bit more complex, and if you're really wanting to dig in and understand it better, would again, definitely recommend reaching out to an assistor or a broker. But typically, it would be after taxes and deductions, sort of, your actual gross income amount. If you are in the process of divorce and already living separately, is your premium affected by that? And do you need the other one's income or health information? So definitely not health information. We do try to draw kind of a clear line. Other than that, totally anonymous tool for quoting. Nothing in our system is asking anything about your health or health needs. Divorces are a little bit more complicated for couples. It can depend on, I guess what I would track it to is the tax year. So if we're definitely not going to be filing taxes together, in the upcoming year when you're applying for, or the current year that you're applying for, you can apply separately, but you do need to include anybody part of your tax household on the application. So that one's, again, a little bit, I would encourage reaching out and talking about your specific situation, but really would kind of depend on the timing of the coverage itself, and whether during the time that you have the coverage, you're going to be legally married, you're going to be filing taxes together for that period or not. And I will say, recognize that was not the question sort of asked in this scenario, but I like to mention it just in case. There are special exceptions for people who have experienced domestic violence. If there's a reason you really can't access the information and want to make sure that there's a clear dividing line between somebody who otherwise technically legally you would be in a tax household with, there are special circumstances for that. So that's something our call center can help with, that navigators can help with. There's some information on, but just like to mention that because I have occasionally, run across cases where that causes some anxiety for folks, and want to reassure them that, there are protections in place for that case. Thank you to Deborah for mentioning there is a small business premium relief program. It is starting to wind down, but that was an initiative of Governor Mills that was funded through some of the funding that came into Maine for relief from the COVID-19 pandemic. She really looked, and there was help through the form of more financial assistance in the individual market, and there was help going to large employers with their COBRA costs for their employees, but there was nothing to help small businesses with health insurance costs, which is a big priority for her. So she, wanted to design that program, which has been lowering premiums for both employees and the employer for small group plans. But that, funding was time limited, a set amount. So that will be ending in April. But yeah, definitely great to flag. I think that any small group plan, I think, should be automatically receiving that, because the health insurance companies were kind of tasked with doing the administration of that program. So hopefully, if you are offering small group coverage, you've seen that. If not, definitely feel free to reach out to your health insurance company or potentially check with the Bureau of Insurance, who's responsible for that. But yeah, definitely a helpful flag, and hopefully that's been helpful and provided some relief at a time that's obviously been really, really hard for everyone, but especially small businesses. And I can imagine, especially small businesses working in childcare.
Something else too, and it was something I actually ran into as I was coming out of the childcare workforce and moving into nonprofit, and I, had a little income raise there. When I had gone on to Marketplace, the plan I was looking at was one price for the premium, and then I went to the actual health insurance website of the health insurer. So in this case, it was Harvard Pilgrim, and I could actually get it cheaper through them. Is that something that happens once in a while, if maybe income isn't eligible for the subsidy? Maybe
Yep,
you want to shop on the actual insurer's website too, to see if there's a difference in cost?
Yep, it's worth taking a look at. I do think that it happens less frequently now. There were a few different dynamics previously that made that a little bit more common. Now in Maine, we've kind of standardized the market a little bit more. And so there's not as much variation in off-marketplace prices, but there definitely could be situations. So I would say probably only for someone who's either not qualifying for any financial assistance, or to your point, might be right on the edge, and so it's getting a few dollars. Definitely doesn't hurt to take a look at each company directly, or that might be a situation where working with a health insurance broker might be worth doing, and asking them for their opinion and what they know about. Would definitely give a word of caution there to make sure the company that you're looking at, kind of check and vet that. Again, Bureau of Insurance has good resources for that, and kind of taking a look and saying, hey, is this a company that the Bureau of Insurance has signed off on in Maine, just to make sure that you are going to get quality insurance is worth doing. But there are situations where, it can be worth taking a look off the marketplace.
Yeah, and this was prior to us having CoverMe.gov, so we're still using the federal marketplace. So I imagine there has been some changes since then.
Mm-hmm. If you qualify to receive financial assistance, is this taxable income that you then need to pay taxes on come tax time? So nope, it's not. It's actually, I call it financial assistance. Formally, what it is an advanced premium tax credit itself. So it is a tax credit. So doesn't count as taxable income. There is a process, and I started to refer to this and then thought, oh, way too technical, but I'll just briefly outline it. The reason that we asked that question in the application about filing taxes is because we provide the tax credit on an advanced basis to people based on what they attest and what they report to us as their estimated income. The IRS does go through a process when you actually file your taxes for the prior year of making a comparison to the income you reported, and if it's significantly different, there are situations where they might ask to get some of the advanced premium tax credit paid back to them, or in the flip side, sometimes people haven't actually utilized everything that they qualified for, and they would get a payout or an offset in any taxes that they owed. So that is something to be aware of. It's something that we always kind of try to flag for people. If you enter one income when you first apply and then have a life change, that means that it either goes up or goes down. Really important to come back and report that to us. We'll then kind of adjust the tax credit for the remainder of the year to balance that out. But wouldn't want folks penalized. There are protections there too, depending on the income that you make. There are caps in terms of how much that you have to pay back. So only folks at the higher end of the income scale are at risk of much of a payback. But it is definitely something that people are aware of.
Does anyone have any other questions? I always learned to give a long pause in case
Yeah.
people are hitting the mute button
I
or.
know, I was like, I don't want to weigh in just in case.
Yeah.
You know, I'm one of those people sometimes who is, I mull it over and I'm trying to decide
Yeah.
whether to
Yeah.
pose it. So I think that to give people plenty of time. I will also say though, I mean, you know, we're connected with Heather now as folks go off, you know, if something else pops up or you know, there's follow-up that would be helpful or you have more questions, feel free to send them over to us. Happy to answer anything. And to Heather's point, continue to kind of emphasize those navigators and brokers and the resource that they are, if you're thinking through these issues or have more questions.
And just to emphasize, deadlines coming up tomorrow at midnight is the deadline if you need coverage by January 1st, right?
Yeah,
And then
absolutely.
January 15th would be the end of the open enrollment altogether.
That's correct. Yep. So, you know, if you want to make sure you avoid a gap in coverage or have coverage as soon as possible, if you do need it, you know, hopping on tonight and quickly filling out that application and choosing a plan is a great idea. And then you can either stick with that plan or, you know, if you do want to make a change, you have until January 15th to look again, could change effective February 1st. But yes, thank you for seeing it again. It's coming up so quickly, but you know, yep, still time. And actually our call center will be open tonight until 10 p.m. Because of the deadline, and tomorrow will be open from 7 a.m. to midnight. So calls will be busy, I'm sure, tomorrow. I wouldn't be surprised if sometimes there's a wait time. We usually don't have one. We try really hard to avoid it, but deadline day is so busy that it can happen. But if you need help, you know, just wanted to mention those extra hours. But of course, the website, you know, up right now if you want to jump in and take a look.
That's great. Well, thank you both so much. And thank you everyone for being on. Those are great questions. I learned even more.
Yeah, it really was perfect. I should have mentioned that. And then someone asked the question and said that for me. So thank you. You helped me a lot tonight too.
Yeah, that was great. And for someone who's been intimidated by insurance for so long, this has been really helpful and wish I had met you both years ago. So thank you. And I appreciate everyone being on. And yeah, if there's questions, follow up, reach out to me and I'll make sure to connect you with Meg and Jillian as well. So everyone have a great night. Happy insurance shopping. Hope you find low premiums and talk to you all soon.
Thank you all so much. Really appreciate it.
Have a great night.
So, bye.